We're going to start by providing an update on our Stop the Spread testing initiative, including the details on the next round of communities that will be launching free asymptomatic testing with our support. But first, I do want to give a daily update on where we are with COVID-19 testing, cases, and hospitalization. Yesterday, the state reported that almost 10,000 new individuals were tested for COVID-19. In total, over 1.4 million tests have been administered in Massachusetts. On Sunday, there were 273 new positive cases reported, which brings the statewide total to just over 108,000. The 7-day average for the positive test rate is 1.9%. The 7-day average positive test rate has now been below 2% for well over a month. Positive test rates have ticked up, going from about 1.7 to about 2%. Obviously, we would prefer to see 0 new cases of COVID, but we know that's just not going to be the case until we have a medical breakthrough like a vaccine. We're closely analyzing the data for trends, but right now we are aware of some small clusters that are associated with gatherings. Obviously, there was a lot of public reporting on the cluster that took place after a private party in Chatham, and there's recent information about an employee at Bay State Healthcare who went to a hotspot state, came back, and was lax with respect to wearing a mask, and there are now a number of people who work at Bay State and a couple of patients who were there as well who tested positive. Our contact tracing efforts continue to be hard at work to isolate these events as they become available, and to make sure that we work hard to ensure that the folks who are affected by this isolate and are supported in that isolation. We can also assume that there's simply a lot more mobility out there, some of that as a result of the economic activity that's associated with opening up some of our Commonwealth's businesses and employers, but some of it's also just people being out and about. It's warm out. And people, generally speaking, are probably in more contact with people now than they were in the months of April, May, and even June. We should all remember where we were when we started this reopening program in May. We were seeing positive test rates at that point that were north of 10% on much fewer tests. That's why we can't say enough about how important it is that until we have a vaccine, that everybody continue to play their role. And when we let our guard down, the vaccine will, or the virus will make gains. To repeat that again, if we let our guard down, COVID will take advantage of that, and the virus will not take the summer off, and neither can we. There are currently 364 patients who are hospitalized for COVID-19 statewide. 56 of those are in the ICU. Those numbers, which is based on a 3-day average, is down about 90% since the middle of April. 2 hospitals are currently using surge capacity. Here in Massachusetts, the public health data continues to be stable, and many of the key stats have improved significantly since the height of the outbreak in the spring. That's because people did the things that we all needed to do to slow the spread. People were wearing face coverings, practicing social distancing, and maintaining good hygiene and cleaning protocols. Our success has been driven by our continued efforts to increase testing capacity in every corner of the Commonwealth. As we look ahead, we want to continue to increase access to testing so we can better understand where the virus exists and track new cases and stop and slow the spread. Increased testing allows tracing for those close contacts of confirmed cases so people can isolate and we can prevent further transmission. While the Commonwealth's made real progress to increase testing capacity and to bring down our positive case rates, there are communities that continue to have higher positive test rates. Some of those communities are also reporting a decrease in the number of tests that were being conducted, which is one of the main reasons we're targeting them for this new testing effort. Earlier this month, we launched our Stop the Spread testing initiative, which provides free, widespread testing. The first round of testing sites was launched on July 10th in 8 communities: Chelsea, Everett, Fall River, Lawrence, Lowell, Lynn, Marlborough, and New Bedford. The initiative in those communities is slated to run through the middle of August. So far, our data shows us there's been a lot of traffic at these testing sites. To date, providers have tested about 19,000 people at these locations. In the first week, the number of tests conducted in targeted communities increased by 48% compared to the week before. Statewide, the number of tests conducted for that same week increased by about 24%. We consider this a good thing because it means that more people are getting tested, including asymptomatic people who may not know they're infected. To date, we've received results back for about 17,000 of the 19,000 people who were tested. Currently, the data shows us that the average positive test rate for those test results was 1.8%. These numbers are obviously subject to change as we add in the last 2,000 tests and then build on that with additional tests as we go forward. Today, we're expanding the program to 8 additional communities: Agawam, Brockton, Methuen, Randolph, Revere, Springfield, Taunton, and Worcester. The second group of communities are reporting a higher COVID-19 positive test rate that's higher than the statewide average. Their testing volume has also come down, meaning residents are not seeking as many tests in these communities as they were previously. Together, these 8 new communities make up approximately 10% of the Massachusetts population, but constitute about 15% of the Commonwealth's positive tests in the past week. The statewide positive test rate over the past week, as I said before, is about 1.9% for the past 7 days. But in these 8 towns, the positive test rate was 2.3%. The number of tests conducted in these communities has also declined by over 20% since the end of April. Testing in these new communities and making it available to all residents will include those who are also asymptomatic. Please visit mass.gov/stopthespread to find a testing site near you and to find out how you can make an appointment to get tested. It's very important that everyone looking to get a test at these sites check with the website first. With these 8 towns coming online, the Commonwealth has now established sites in 16 communities statewide for free testing. In addition to other dozens of testing sites in every county, we're increasing our testing footprint to better understand exactly where the virus exists, who has it, and how we can follow up through our tracing program and other initiatives. With more testing and tracing, we can obviously identify more transmission, particularly for asymptomatic populations, and continue to contain the spread of COVID. If anybody believes they have the symptoms of COVID-19 or has been exposed, please stay home and stay away from others. Contact your clinician and visit mass.gov/stopthespread to see if there's a test site nearby that works for you. If there isn't, make sure your clinician works with you to find a place where you can get tested to determine if, in fact, you have the virus. As we prepare for the fall and ramp up stricter travel restrictions, more testing will be a pillar of the state's COVID-19 prevention strategy. We'll continue to bring every resource we have to bear and are grateful to our healthcare community and our frontline workers for their tireless efforts to contain and fight the virus. As I've said many times, COVID's not going to take the summer off, and neither can we. Every resident, every business has a responsibility to do their part to stop the spread. Please keep wearing your face coverings, socially distance wherever you can, and use common sense. That's how we continue to succeed in containing the spread of COVID here in Massachusetts.